Hi, everyone. We're just getting ready to get started. We're waiting for a few more to join in here. Let's give everyone it and we'll get started. Well, hello, ISPA family, and welcome to this special edition of the ISPA Town Hall series. I'm Frank Pizzicalis, the chairman of the ISPA Foundation, and we're excited to have you join us today for this in-depth discussion about the 2021 ISPA U.S. Spa Industry Study. As a reminder, following today's session, all ISPA members will receive a copy of the full 2021 study results report. So be on the lookout in your inbox for that. It really is important, the work that we do here in the foundation, like having this study over the many years that we've done it with PwC, just provides us that long lens of being able to really look at our industry. So this is just one of those valuable resources that the ISPA Foundation is able to provide to our members because of the contributions that you make to the foundation. So thank you for that as we continue to create education and research for all of you. I'm thrilled to welcome Colin McIlheney and Russell Donaldson all the way from Ireland at home from PricewaterhouseCoopers onto our ISPA virtual stage this year. So welcome to both of you. I know you've had a little bit of a heat wave there in Ireland, not used to that
Exactly.
heat and all that high humidity. So how are you all doing?
We're doing well, thanks very much, Frank. It was indeed once in a generation experience with 90-degree heat here.
And that doesn't sound, to a lot of Americans, that probably doesn't sound very hot, but I know that when you're not prepared for it, having all the air conditioning as other places would have that are used to that sort of heat, I know it can be very uncomfortable and some sleepless nights. So I hope you're all doing okay and everyone's fine. It's like snow in Orlando. You're just not prepared for it. So welcome, Colin. Maybe you can share a bit of history here on the study and the foundation, the work that we've done together.
Sure, Frank. Thanks very much. Yes, I mean, this study goes back a long way. I think it's one of the longest pieces of collaboration that PwC does with any organization. I think one of the very few longer than that is the Oscars, where we've counted the votes for a long time there. But this is a particularly long-running and enjoyable collaboration. It dates back to 1999, and myself and others in the team, like Russell, have been so happy to be involved for that long time. I think also the longevity is important to give people a context of it, because it's like having the institutional memory of the study. You can look back on it and say, okay, well, how did we deal with particular things, maybe going back to the Great Recession and also the sort of mid years of the early 2010, 2011, and the recovery period, what happened then. So it's been a really important, and I think landmark study that the ISPA and the foundation have put forward over the years, because it sort of has differentiated ISPA and the industry. I think because you have this wonderful tracking record dating back to 1999, and I think if I look at it this year, responses from over 2,000 separate locations, it does stand testimony as a sort of, I think, a very important landmark piece of work for the industry as a whole.
I agree. And actually on that, maybe Russell, the big five, as we saw in the big five, there's, revenue losses during the pandemic. And we're sort of similar, as Colin was saying, sort of similar to the Great Recession. Can you kind of talk about, those two events, sort of the pandemic and the Great Recession and the recovery from them, and how they might even be different?
Yes, Frank, thanks, I will do. And hello again, everyone. Maybe it would be helpful at this stage if I just share on screen what that we have for the big five this year. And just as a reminder for everyone as to where the industry finds itself on those very important statistics. So I'll pop those up and you will all hopefully see those on your screens. So I'll start with revenue. Obviously, it is the big statistic that everyone looks for every year. And you can see on the left-hand side of that screen just the extent that the pandemic affected what was a very, very strong and sustainable growth throughout the decade that had preceded it. So down 36% in 2020, and a little bit less of an impact on revenue per visit. That was more of a reflection of revenues falling more strongly than visits did. And that's not a sign people should be reassured of falling prices. It's more likely the different combinations of treatments and services that were purchased throughout the year. And on that note, visits, if we have a look, what has happened there on the next slide, that they have fallen 35% in 2020, unsurprisingly, when so many spas had to close throughout the year, a big impact on the number of people that could visit them. Consequently, unfortunately, the number of locations fell in 2020. Closures outpaced openings by a number of approximately 800, so slightly fewer spas on the landscape now than there were before the pandemic. And then employment as well, a fall in the total number of employees. I'm sure that's a topic we'll keep coming back to throughout our discussion today. But now just over 300,000 employees in total in the industry in 2021. And good news for everyone, just as a takeaway from this session today, you will all receive a link to the Big Five, and that you can take and refer back to after the session has ended. So I'll stop sharing my screen and come back to the question that you asked, Frank, about the difference between what happened here and what happened at the Great Recession just over a decade ago. I think that the big message is that we have to be careful of comparisons between the two events. 2009 was very much a crisis of demand. Why was that? People's disposable income fell. They weren't able to spend that on going to spas. So demand for spa going fell at that time. But in 2020, it was a crisis of supply. The spas were forced to close because of the public health measures and the various shutdowns that there were. So it was actually the opposite this time, a crisis of supply that caused the problem. So perhaps we could say that the illness was different, but actually the symptoms have been the same this time around, because a decade ago we saw a 43% drop in revenue because of the Great Recession, 36% this time, a 10% fall in visits, 35% fall in visits this time. And at that period, a net decrease of 700 spas, whereas we've seen approximately 800 this time. And I think the key message from looking back at that period was that everyone thought it was a once in a lifetime experience. And I think there is a general view that the spa industry handled that existential crisis incredibly well. It weathered the storm. And actually, in the decade that followed, leading up to the pandemic, it showed itself to be resilient, sustainable, and it quickly returned to a growth position that everybody very much hopes to see again this time.
No, absolutely. No, it's fascinating. And you know, when you're comparing the time over time and just the differences in these events. And Colin, you know, at the Stronger Together Summit in May, you said, you know, if you open, they will come. Has that pent-up demand that you hinted at, you know, really played out the way that you've expected? I know we're not out of it yet, but you know, the signs of what you're seeing.
I do so. I think so, Frank, definitely. I think if you look at it, maybe one of the recurring phrases that's been used is pent-up demand coming to the surface. Mm-hmm. I think that's pretty clear across the board. I agree with you, not out of the woods yet. Certainly if you look at the COVID pandemic and the sort of level of cases. But what is very clear is that there is a widespread and pent-up demand to get back to wellness and to get back to the spas if they can open. I would maybe add to my thing when I said open it and they will come, I would also say open it safely and they will come as well. I think that's a crucial thing we're seeing across the work that I do in retail and consumer areas, where it's quite interesting that people are putting a high premium on feeling safe and secure in the environment that they're returning to, whether that be the spas or restaurants or hotels, etc., right across the leisure space. But it seems to me very clear from what we hear that when spas are able to reopen and reopen in a safe and secure way, there is absolutely no shortage of customers. And also, I think Russell touched on a crucial point. Unlike back at the Great Recession, when I was working with you and others, where there was great discussion around the D word, the discount, that it was discount-led recovery. That's not the case in my view at this stage, that this is not a discount recovery-led. This is a demand-led, another D, but a better D, as I would put it.
Indeed, indeed. So outside of the big five, is there a data point from the study that you feel is especially revealing about the pandemic's impact on our industry sort of moving forward?
I think, Frank, what struck me as we put all this report together and as we looked through the data, for me, it's vacancies and the number of unfilled positions that remain in the industry, and especially unfilled service provider positions. That actually, that number of unfilled service provider positions currently counts for the equivalent of 12% of the workforce. That's a big number, and we've talked a lot in recent years about that as a particular challenge for the industry. And I think that this year shows that actually the pandemic has not masked that at all, that it's still a challenge for the industry to face and think about as we move back to something hopefully resembling normality. There's a point in the report that more than half of spas have openings that they are trying to fill. I think that highlights very starkly this point on vacancies, and it's something for the industry to address. And Colin, would you agree with that as well?
Yes, I do. I think if I was put on the spot for something that stood out to me, I would take another, this time the V word, and I'm never one to shirk controversy, as you know, and things. So for me, I would look at vaccines. So I'll tackle that now, if I may. I think what struck me about the data was we actually correctly, I think, asked at the time about would spas be making it mandatory for staff to have vaccines to work in the industry. And I think it was all about timing. At the time, what was clear was that there was no rush to make that mandatory or compulsory. It was very interesting that the data was spread in the report, which people will see at the time, across sort of, yes, we're going to do this, no, we're not, but there was a lot of uncertainty. And I think that was, the timing. What will be very interesting to see is, as time unfolds over the next number of months, is what is led in this area by the consumers and what the consumers expect and demand. And there's a huge debate right across both sides of the Atlantic on what we call vaccine passports, et cetera, et cetera. So I would suspect that the jury is still out on this, but it was it stays at the moment for me as a data point to really keep an eye on, because clearly if consumers are asking for certain things, then the industry will have to look at that and say, okay, how do we respond best to this demand from the consumer side? And of course, from the staffing perspective as well, from their side, they want to be safe as well. So there's obviously a lot of issues around who's coming in. And if you like, the entry turnstile into, we see sporting events, et cetera, where, evidence of double jabbing, as we would say, is required. And this is a whole frontier point that still has to be addressed, I believe, as time goes forward.
Agreed. And can you talk a little bit about the varied impact that you saw in the study from sort of resort hotel spas compared with day spas, and how their recoveries may differ?
Yes, very much so. And one of the things that you can't see in the overall numbers that we've been talking about today already is just how the pandemic has had a different impact for different spa types. And as you all look through detail in this report, there's nowhere where that is more evident than looking at the differences between day spas and resort and hotel spas and what the numbers are showing us. And when you think of the reliance that resort and hotel spas have on out-of-town guests, and combine that with the fact that actually air travel into and around the US fell by 62% in 2020 because of the pandemic, you start to get an idea of why, for example, the revenue impact is seen much more starkly in resort and hotel spas than it was seen in day spas, which still saw an impact, but at a less stark level. I know, Colin, you're very much a guru of travel statistics, as you probably have something to say there as well, and where we are with travel now, because I think where travel recovers to and how soon that happens is probably key for the recovery of resort and hotel spas in that particular sector as well.
Yes, Russell, indeed. I think there are a couple of really key points here. The first is that there is clear evidence of recovery in US domestic travel. But that is well ahead of where everybody is on international travel, which obviously has a whole lot of other roster of political and economic issues attached to it. But the recovery of domestic flights and sort of unrestricted internal traveling from A to B, from Miami to Boston or whatever, is clearly very helpful. The big attractions of a lot of resort and hotel or destination spas in many occasions is the beauty and sort of raw beauty of where they are, and in the location. But if you can't get to it, that's clearly a major problem. And that was the issue. A lot of people, there's no flights, etc., and people couldn't fly in. But I do think that the restoration of international travel will be particularly important. If you look at access points on the west coast of America and places like California, which is the sort of foundation really of the spa industry over many years, you're going to have to see over time a restoration of international travel coming across the Pacific, etc., as well as the Atlantic. And at the moment, that I still think is a bit of a way off, although I saw today, just before we come on this call, that the British government, for instance, are making travel much easier going forward for the US and backwards. So that hopefully some form of, corridor, I think we're referring to it, will open up and allow international guests, because that is vital for the recovery of the US spa industry.
Absolutely. So I have, before I carry on with some of the questions that I have, I've got a couple of questions here from the chat. Alicia Jones says, good morning, and I'm in the process of planning a spa opening spring 2022 in Virginia. Based on the study findings, what are a few important operational things I should consider before opening?
Yeah, that's probably a good link into talking about some of the operational policies and activities that we've been able to identify in the industry study report this year that spas implemented and offered maybe for the first time in 2020. We saw a change in treatment and service duration on the kind of offered by about 3/4 of spas in 2020, and also a revision to the menu, either a new menu or a revised menu on what there was before. About 3/4 of spas were doing those things to adapt to the pandemic. So those were clearly important things for the industry. The other thing behind that, which about half of people told us, and this is a little bit more specific, was this idea of outdoor and curbside treatments that about 50% of the respondents were offering. I think whether these things that spas have identified that they were doing in 2020, whether they stand the test of time, I think will depend whether they were a direct impact of the pandemic and the conditions at the time, or whether they were trends that actually the pandemic had just accelerated. And in that regard, I think it's probably, as far as evaluate that, worth thinking through a couple of things. First of all, is it generating a more service-oriented approach for the customer base? What is it doing to improve their experience? Or is the policy or measure leading you as a spa director or manager to run the business in a more efficient way? So that could be something like online bookings, sort of technology, contactless payment, customer databases, and that sort of thing. And maybe that is a helpful kind of thing to bear in mind when thinking through the policies and activities that may be useful at such a strange time.
Yeah, and I think a lot of spas, anecdotally that we work with, it seemed that they were taking that time when they were closed to really think about their business, right? And think about, should we be offering these treatments during high demand times, these others that that would maybe yield a higher profit, and those sorts of things. So there seemed to be a lot of kind of rethinking about the business, and like you said, Russell, I think that's healthy. That's healthy thinking to do, and not just sort of continue to operate the way that you always have. You need to start to think about, obviously, spas used to be resource constrained with treatment space, but now they're resource constrained, with staff. So they have the space, but it's the staffing that's going to be the limiting factor here, as we all work as an industry to solve this issue. And actually, one of the questions here, which leads into another question that I have for you gentlemen, is from Jerome Lockhart, says, what are the major reasons for a consistent 12% vacancy? And maybe we can tie that into the workforce data that you saw in the study. And what does it tell us about the sort of the industry's recruitment challenges, and at the height of the pandemic to now?
Maybe if you like, I can give a little bit more detail on the comment I made earlier about some of those unfilled positions that we talk about in the study. And I think so an overarching summary here is perhaps that what people thought might happen at the start of the pandemic hasn't really materialized. That there was probably a sense at the start that actually this idea of vacancies had been such an issue for such a long period in the industry, and actually now with perhaps the workforce falling in number, maybe that would mask the problem or reduce it somewhat. But the industry study this year has shown that that's probably not the case. So more than 36,000 unfilled service provider vacancies, and massage therapists making up more than half of that 36,000 number. And also more than 2,000 spa manager and director vacancies as well. So, big opportunities there for people that want to either come into leadership positions from other industries or develop in their own careers into leadership positions. And I suppose in a workforce numbering about 300,000 people, that is an inefficiency. There are so many more people who could be contributing revenue who don't currently exist in the industry. And I think it is probably key we'll be thinking is, are the same issues that were causing the vacancies beforehand also driving the vacancies now? I know, Colin, you remember the inaugural workforce study we did with ISPA back a few years ago, and I'm sure you'll have thoughts on what was causing some of those issues back then, and how that might be applied now.
I think a critical thing that Frank touched on was taking the opportunity, to review the industry and your own business as a whole. And if we look at the critical aspect, I believe that staffing is an opportunity for the industry to reflect and actually cast the net wider. I also believe, by the way, that this is critical on the consumer side. So I would look out, sort of diversifying further the workforce, not just treating it as a pool, a set static pool of people who might be available, but reaching out to parts of the workforce who maybe haven't come to the industry. There's a real opportunity here to diversify, as I say, further, and to look at opportunities for growing the workforce. Clearly, there are aspects that people have reflected themselves, and one has to expect that. They've reflected during the pandemic themselves and where they want to see their own career going. But there has been issues over time around education, making sure that also people could be really seeing the benefits of coming in to the industry. That's a critical part, to get the people in, because when we did the staff survey, we saw that a lot of people, once they were in the industry, were thriving and that they were enjoying the work that they had. But the challenge was to get enough people to the starting post. And at the moment, the biggest surprise that everybody is seeing across the board, no matter what aspect you're looking at, is the shortage of workforce and the challenges that I believe that will pose to everybody. I just also wanted to pick up on another point that was made there on the question about operations in the spa. There is great learnings to be made, and Frank's touched on it in this area of dynamic pricing, where the airline industry was very much the leaders in that, and looking at demand levels and flexing pricing and schedules accordingly. So I think there's been a lot of time for people to reflect at the moment, and the thing is to use that time wisely.
No, absolutely. And even dynamic availability, like just not changing your price, but just certain services just aren't available at certain times. And you're going to move them into, higher margin treatments that could yield more price. So we do have to think about this whole staffing challenge. And, I think we also have to rethink because it's such a huge revenue opportunity for the industry, as you said, Colin, that do we rethink how we compensate our staff, like benefits for part-time estheticians? Michael Tompkins just said, is that a solution for massage therapists and estheticians? Should we be thinking about benefits to them as well? And so there's a lot of factors here, certainly around what we can be doing as an industry. And I know that ISPA is certainly working with a number of organizations to continue to work on this issue, because it is obviously a critical one for our industry.
I think, if we go back, as you say, to nearly the start of this discussion, when you said about open it and they will come, I was sort of at that point, as you know, in the symposium, talking at that stage about the customers coming back. But I think open it and they will come is now also a very important point about the staff, getting people to come, and all these aspects about benefits, about, everybody in some way puzzling over getting the staff. Behind all of that, Frank, and I know people will be saying, is the sleeping dog at the moment of inflation, which will obviously is coming more and more to the fore. And all of this discussion taken in the round leads you down that road of discussion around, we're not seeing it as much, we're seeing it more in terms of materials and costs, but there is wage inflation on the horizon if you take all of these issues that everybody's raising in the chat as well into account.
Agreed. And that's why I say, I think you have to recognize that on the staffing side as part of the solution, but then you have to also rationalize and rethink the business, because the things that may have worked in a different set of scenarios, may not work today. So you have to rethink how you're offering your treatments and really those margins to ensure that you have a healthy business, because the financial health of the business, as we've learned, is just as important as anything else, with all the stakeholders that you have, your staff, your owners, and everyone in between. So I just have a quick, actually, I'll come back to this question. And I know that ISPA is working on a talent toolkit to address some of these issues. So just like we worked on sort of the pandemic reopening toolkit, I know that we're gathering the best minds in the industry together again and trying to work on these resources and tools so that ISPA can deliver these to our members and to the industry so that we can tackle this very critical issue. So I just want to move on quickly, gentlemen, to retail. So many spa retail efforts were transformed during the pandemic. So what does the data tell us in terms of how spas have adapted their retail models and what impact those adaptations have had?
Yeah, I suppose the first thing to say is that spas that had a retail offering in place when shutdowns came, and especially if they had an online retail operation in place, all of a sudden found themselves in a stronger position to still have some sort of revenue base. So the technological thing is probably a first point to say on that. But actually, we found in the industry study this year that 93% told us that they have a retail element, and the average dollar spend on retail is still $43. So it's still a very important source of revenue for the industry. And in addition to the things that we have seen over the years that are always the top items for spending on retail, so skincare, gift cards, still right up there. But of course, very interestingly, with the time that we're living in, number 3 on that list of the most purchased items in spas this year was personal protective equipment. So PPE right in there, and spas able to avail of that opportunity and the need that society had for that, to provide that, and then to have that as a revenue stream as well. So I think that was an important thing to bear in mind with retail. Colin, would you add to that?
Yeah, I think that the very important thing is sort of like called retail for the pandemic, and when you looked at it, so many people, let's say in uniforms and places like that, were able, core business like that, we're able to flex and go into sort of PPE and gowns and etc. So I think being nimble, agile was really important on the retail side, and seeing, okay, we might not be able to sell what we were selling, but I tell you, we can flex and start selling stuff that people really need and really want at the moment. And then, of course, reverting back, we hope, as we come out of the pandemic, to things, so product choice, et cetera, and as you say, online, and also just making it easier for the people to get the retail products they want at a good price point. But I was quite struck by how many organizations quickly realized that the pandemic wasn't going to shut down retail, but it was going to need retail element to adapt and to cater for different demands from the consumers.
Agreed. So I have a question here from the chat from Karen Minahan. She says, can Colin elaborate on what diversifying the spa industry looks like?
Yeah, absolutely. What I was thinking was it's trying to just think of, okay, let's look at the moment over the past years. We've got a number of vacancies. Where are they? What types of jobs are they? So diversification there would be like trying to open one's thinking to perhaps demographic groups that have been maybe underrepresented before in the workforce, or particular reach outs to groups that have not been taking up vacancies or putting themselves forward. That's really what I'm getting at, is this idea again of considering where we are and saying, right, there's clearly a workforce issue. Is part of it that we could reach out into communities, locations, demographic groups who haven't really taken up maybe as many opportunities in the past in the spa industry, and somehow attract those people in, opening up. And also, I should say, I mentioned it as well in relation to the consumer base. I believe that there are opportunities there, not to say, okay, what's our typical customer? That's all gone out the window. We're now looking at a period of saying that, okay, I mentioned about international consumers coming back, but there also was a massive rise in the number of people who were coming from just around the corner, like local business, local people coming in, walk-ins, etc. So the demography of both the staff and the consumer, I believe, will change, and needs to probably change in the coming couple of years.
Well, and the interesting paradox here is the demand is increasing. When you think of people that have gone through the pandemic now, even more are thinking about their own personal wellness. So the demand for spa, for wellness, in our lives is just going to continue to increase, right? And at the same time, we have this this supply issue from a resource perspective. So it's something that we certainly need to solve, because it's a massive business opportunity, and it's not something that is going to go down anytime soon. And I think it's on all of us to try to figure out ways to deal with it, and obviously to improve the situation for our industry. So, gentlemen, I just got one last thing. By the time we get together again in Las Vegas for the ISPA conference in May 2022, which trends do you think might be shaping, the industry at that point, and that we might be looking at in the results from next year's study?
Well, I suppose there's still, at this stage in the COVID world, there's still so much that we don't know. There's still so much uncertainty, and I'm sure there will be things that we see when we, all being well, conduct this research in a year's time, and that we're hopefully all together talking about it in Las Vegas. I'm sure there will be things that we see then that are direct outworkings and results of what happened in 2020, things that are still only working out more gradually over time. Personally, for me, the big uncertainty is the point that Colin made earlier about inflation, and the two very different popular views on what might happen there, because it does appear to be slightly ahead of where the forecasters would perhaps like it to be at this stage, and it does appear to be affecting resources slightly more so than consumer pricing at this stage, and importantly for the spa industry, and in fact, all industries in that regard, is what will it do to compensation to wage levels? Will it drive some sort of wage inflation, and what will the impact on businesses, consumers, and the wider economy be? And I suppose that point is as relevant for the spa industry as it is for every other consumer-facing industry out there. But I suppose that is the big uncertainty at this stage. That's one thing that the crystal ball just cannot see into, that at this stage there are very different schools of thoughts about what might happen there. Colin, would you agree with that too?
Yeah, I think I come at it from the perspective of the lens of the consumer. When we get to all hopefully get together in Vegas, I'd be very interested to see how has it unfolded, the consumer insights, the consumer experience. What did they make of it going back to the spas? And I honestly believe, I've been with Frank all way back from the 1999 onwards, I've learned it's difficult to predict. We all know the future, but it will be consumer demand led. I believe we'll see the big trends emerging, and it'll be very interesting to see how spas respond in terms of what I touched on, in terms of making the experience secure, safe, and differentiating itself from other offerings. I think Frank's right that wellness is very in vogue at the moment in terms of what people coming out of the pandemic will want to do. I think also, touching on a point I made earlier on, just on actually getting together in Vegas, I'll be fascinated to see what it's like. Will we be arriving with COVID vaccine passports? What will be the protocols in place, etc.? So I know it's an industry, because I've got to know so many people that loves hugging. Will we be hugging? Just practicalities which actually affect everybody's day to day. But I would, from my side, wrap up by saying that I believe, having been involved for so long, there's a resilience. So I would say I expect to see that resilience coming through when we meet. And like every sector has been really affected by the pandemic, but the spa industry is positioned, because of what it does and its beneficial health aspects, it is positioned as well as any sector to recover quickly from this terrible period of time that's affected so many people across the US. So I'm upbeat from the point of view of that. By the time we gather in Vegas, that I believe that some of the big five statistics, and everybody will be interested in that, I could see, I hope, a relatively rapid bounce back in some of those.
Agreed. I'm pretty bullish on it as well, Colin. I think we'll be in a different place And I think there will be hugging. I'm going to go out on a limb and say there will be hugging in Vegas.
Okay, Frank, that's
be
good.
there.
Okay.
But there's obviously a lot of things to keep our eyes on here as things continue to evolve. So this has been, extremely insightful, and I appreciate both of you with your analysis and insights, providing this great information for you, and really everything you do for ISPA. I just want to say thank you, and thank you to everyone that's in attendance and joining us today. And just a reminder to ISPA members, be on the lookout for the email in your inbox this afternoon with a link and access to the full study. So this is a valuable member benefit, and grateful for everyone that contributes to the foundation, so we can provide that to all our members. And thanks again to you both and to everyone. Have a great day.
Thank you very much, Frank. All the best to you all.
Take care.
Bye-bye.